And welcome to this week's Vets I Recommend. I'm Carrie Hyde. I'm your host, and I have some fabulous veterinarians. So it's always very interesting for me when I'm introducing vets because I get really excited. I always think I'm not Ellen DeGeneres, but I wonder how excited she is when she introduces like big movie stars. And I know that seems kind of weird and cheesy, but these are mentors of mine. These are people who help me do my job better. Some of them are retired veterinarians. Some of them are practicing veterinarians. Some do online. We have all these different veterinarians that came on board. I think we have a total of 15. But tonight's veterinarian I'm going to introduce you to is Dr. Richard Mccarron. Hi, Dr. Mccarron.
Hi. I see that I didn't put my whole name in. Sorry.
Oh, that's okay. I know your name by heart. It's not. I'm really bad. I botch names a lot, but yours is in the back of my head so much that sometimes when I introduce other doctors named Richard, I almost say your name.
Ooh.
Yeah, not good. And I wanted to share something with everybody today when I talk about how excited I am we've done 2 podcasts together. We've talked about homeopathy and actually a vegetarian diet, which was very interesting. And I got a lot of phone calls about that one, which we knew was going to happen.
Yeah. Be interesting to talk about that.
Yeah. I was telling Lori that I was so interested in your first book that you wrote many years ago that the vet that I was working for at the time, I kept regurgitating stuff. I think he was not too happy. I was like, he was very traditional veterinarian. I think it was all of about 19 and read your book and thought I knew it all of a sudden. So I would bring this to him, and I definitely did not approach it the right way. So I probably lost him because of that. So it was a lesson learned, right? When you want to teach somebody, you have to approach things properly. So
it's hard to communicate clearly, isn't it?
It is. I was just excited. I was 18 years old and I was excited. And oh my gosh, this is gonna change. And wait till this vet finds out. Like all our animals that we were seeing that were so sick, and we're continuing to eat, the traditional prescription diets, and they weren't getting any better. And so I was very excited to share that information. And since then, you have written how many books?
Well, it's in the 4th edition.
The 4th edition, and it's evolved. There's been, if I go back to the first book to the book that you have now,
It started out really the first book was really sort of the fruit of the time I'd spent learning about nutrition. When I went through veterinary school, I didn't really have any training in nutrition for dogs and cats and so on. We did have classes for nutrition for horses, which of course I never used.
That's interesting.
It was. There was a lot of emphasis on that, but there was not any. There was, I think, a half hour on dogs and cats.
Wow.
So I didn't know much about nutrition, and so without going into all the detail, over the years I gradually kind of woke up to the fact that it was a factor of importance. And as I began to learn a little bit about it on my own, it finally culminated in that first edition. But as you say, it evolved because our culture changed.
Yeah.
And as our culture changed, and as agriculture changed, and as environmental conditions changed, I had to update the book to compensate for that.
Yeah.
So it has gone through a number of changes in that sense. Yeah.
That's what I love about you is that, and I try very hard. It's hard. People don't like change. We get stuck in our ways. But if we don't evolve, that's why I remember when I had a first conversation with you, I wanted to do a podcast about homeopathy, because for those of you who are listening, and when you're ready to start asking some questions, shoot them out to us. But Dr. Mccarron, he's considered the modern day homeopathy genius. And so a lot of people who want to learn, about homeopathy contact Dr. Mccarron. But when we first talked, I don't know if you remember this, I said, if there's any other podcast topics you want to talk about, and you said, well, I would want to talk about vegetarian diets for dogs, but you probably wouldn't want to do that. And I said, no, I would, because I don't think you can have as much respect as I have for you to say, oh, well, yeah, but everything else you say doesn't make any sense. So you came on and we talked a lot about a vegetarian diet, and it's interesting because I walked away from that podcast thinking, it's not necessarily what is in the vegetables for the dogs and cats. It's what's not in it.
Yeah.
Right?
Yes.
It's what's not in it. And that's what I started thinking about is, wow, it's what's not in it.
Well, it's both that and also what's in it we don't want to have in there.
Right. That's what I mean. Like it doesn't have, that's what's not in it that is good. It doesn't have as much of the toxins in it. And so
Right.
after having that conversation with you, I went and I really sat on it for a while. I'm definitely not ready to go.
Right. Right.
But I have put a lot more veggies and reduced the meat that my dogs are eating. Absolutely.
I have an interesting anecdote along those lines. The difficulty accepting this is I won't go in detail or identify who it was, but it was a person that had worked with me, studied with me for a very long time, and had seen tremendous results and was using homeopathy. And no, I'm trying to say that this particular person was a real follower of my work.
Yeah.
With a lot of confidence in my work.
Yeah.
And when I came out with the last edition where I emphasized vegetarian, oh my God, I got the nastiest emails. And the last one I got was saying that I didn't really know much about anything. I didn't even know the difference between a dog and a horse.
Oh.
And so I responded to the email saying, well, I think the horse is the bigger one, isn't it? And that's the last I heard.
Oh, good for you. That's a good response.
But it's hard. It's hard for people to give up their prior thoughts. That's the challenge to us.
I will tell you, I'm looking into it as best I can say. I've made some changes, but I do remember when it was really hard for me to remove kibble from my store. So I have to admit, for a while, I started making these justifications for kibble where I would say, well, I only carry the best kibble. I only, that one. And so I justified it for a while until I was ready to just say, I have to look at this and I have to bite the bullet. And I pulled all the kibble from my store. I no longer carry any kibble at all. So I understand that when you stand up for something, because I sold kibble for a long time under the idea that there was a better kibble. And 15 years of selling kibble. And then one day I have to come out and tell people everything I told you. That's a hard thing to swallow, right? For people. So,
well, Carrie, you're really exceptional.
Yeah,
most people will not give up their prior beliefs. They simply won't.
It's hard. It's hard. Yeah. It's hard. I see people on Facebook all the time attack each other, and really it's just the ego and the pride that get in the way. And
well, yes, it is. But I think maybe a more accurate understanding of it is that we, as we grow up, from being children, and we accumulate a lot of ideas, and people talk about conditioning, right? How we're conditioned. Right. And what they mean is that we are given ideas that we accept as true understanding of the world and of reality. And so as we go along and develop a personality, that's a continued process of accepting ideas like that. And so the problem is that when we start to think about giving up something, thinking it might not be right, it's fearful because we think we're giving up ourselves.
Yeah.
It can almost feel like you're considering possibly dying a little bit.
Oh, yeah.
Because that's our identity.
I was just going to say we're wrapped into our identity, what our identity is. Yeah.
So what's necessary is for there to be an insight that it is not our identity. It's what we've accumulated. It's our baggage.
Yeah.
And it's useful or it's not useful. That's what should be the criteria.
You should teach Buddhism.
Okay.
It's true. All of our beliefs, a lot of that kind of stuff that you talk about, you should maybe teach a little bit of Buddhism. That's what's so great about you coming on, and some of the other veterinarians that agreed to come on, is that you guys really are at heart a teacher, I think. And, some people can take this knowledge and they can, keep it to themselves and it works great for them. And they don't really want to teach people because you come up against, like you said, horrible email, which I think is just sad to have somebody not agree with one thing you say and therefore everything you say they're going to throw out the door. That's horrible.
Well, I thought it was funny.
Well, that's a good attitude. That's where I hope to get in my life someday, where when people are mean and cruel to me, I can laugh it off. But I'm not there
Yeah,
yet.
well, I realized, as we're talking about, my career was such that I took a different path in veterinary medicine, going into
Yeah.
alternative medicine, going into homeopathy, going into nutrition. So, of course, I experienced people that were interested like you are, but I also experienced the opposite, people that were very critical. So over the years, I just learned, I guess I can put it as a summation, I learned that what people think of me has nothing to do with me.
Yeah.
It's entirely their experience, not mine.
I feel like I'm here for a reason. You're preaching words I need to hear right now. It's like a good therapy session for me, because the more I become more and more outspoken about this, and the only reason I think people like you and I become outspoken is we see the change and we see the difference in the animal, and then we get it.
Right.
For me, I can't speak for you. I get so excited when I see some changes in an animal that didn't
Right.
require heavy
Yeah.
drugs, and I want everybody to see it because it's exciting.
Sure.
But some people are so cruel. I recently had a really, really cruel situation, and I mean, I was in tears, and I told Lori, who's the one that I said, I'm never ever doing this again, and big baby, but I'm back, so I managed through it. So we're going to get to some of these questions. So Janelle asks, in your new book, do you share diets for specific needs for dogs? Could you share what it is in the book? I appreciate both.
Yes, we did the new edition was we rewrote, my wife and I should say my wife Susan is a major figure here, though she's not in this meeting, but she did almost all the nutritional research for this last edition. She spent a lot of time developing recipes that were balanced and complete, and also as part of the development of the recipes, we also categorize them as to suitable for particular conditions. Now, not every possible condition, but for example, there's certain diets we recommended for kidney problems. And then there were other diets, I even forget the categories now, but you'll find that in the recipes, there's codes at the top of the recipes, and some letters that indicate what particular conditions they're especially useful for. So we did put a lot into that. Susan put a lot of energy into matching up the recipes to recommend to people reading it what they could use.
Yeah. Yeah. I would imagine you probably hit some of the most common ones that we see: the kidney, the pancreatitis, kidney we see a lot of, those kind of things. There are obviously some rarer ones, but we see a lot of pancreatitis, diabetes. Like, oh my gosh.
Yeah, I should have looked at it before we talked here, but because I forget now all the different categories, but they're common ones, as you say. They're the most likely ones. People would ask, my dog has a kidney problem. What should I feed? My dog has a heart problem. What should I feed? That kind of thing.
Yeah.
And so it's very useful information. The recipes that were developed here, the majority of them by far are new recipes, and they're all balanced as best we could determine, meeting the standard. And of course, we recommend organic, and we recommend whole foods as much as possible. And so the recipes are very, very healthy ones to use. And also what Susan did was very interesting with some of the recipes. She worked them up so they're suitable for both humans and animals. So you could fix something for yourself and feed it to your dog or cat.
That is the greatest thing. I hear this. I know you're not practicing anymore, so you don't probably hear it as much, but I know you did in your practice. You can't. I don't feed my dog table food. People they're so excited to say that, and then they are shocked when I go, oh, well, sometimes your table food might be better than what's in that bag that you're feeding your dog. And they are like, well, I was always taught no table food. I'm like, well, maybe don't.
I always
say don't feed them at the table because you'll start a problem, but table food is probably a lot better. But yeah,
I was taught the same thing in vet
yeah,
school. Don't feed table food. I
yeah.
never asked why.
Right? I know. I mean, it just got in our head. It got in our head. So it's just interesting to think that we still are having that I still hear it all these years later. I'm still hearing,
Uh-huh.
and that
Yeah.
my pet needs to eat kibble because it cleans his teeth. Like I still hear
Oh.
that. I still am hearing that. And every time I hear it, I cringe just a little because I used to tell people that as a vet tech because I
It's
was
so,
taught
it's such an odd idea in a way
it's
because
embarrassing.
in nature like a wolf or coyote, they keep their teeth clean. I mean, it's not nice to talk about, but when they kill an animal and they start chewing it up, you
Yeah.
know, they're chewing down on the skin and on the bones and on the gristle and the tendons and everything, and their teeth are gnawing against those hard materials.
Yeah.
And you compare that to kibbles that are like little cookies.
I
Come
know.
on,
I
there's
know.
no way they're the same.
I know. I know. It's hard. But people still, I mean, some of those marketing techniques really stuck with people. They really got in there and kind of stuck in there. So,
Only own the carry only if you believe them.
right. I know. But, we were, I know I was taught the veterinarian knew everything. So if a vet told you kibble cleans your dog's teeth, we didn't question it. We just thought, oh, okay. Yeah, that makes sense. And then we went home and we fed our dogs kibble, and then their teeth fell out
Right.
by the time they were 7 years old. And then we had to pay for all the dental care, and it just went
Yeah,
on and
yeah,
on.
right, right.
It took me a
Yeah,
long time to realize how dumb that argument was. So I have a question that came across, and this is for all of you who are listening. Sometimes it's hard for you to get on at 4 o'clock, but because we do this every Wednesday at 4 o'clock. And
oh,
sometimes it might be hard. It's not always with Dr. Mccarron. So you're in for a treat right now because you got Dr. Mccarron, but he's not always the vet, but every Wednesday at 4. So if you can't get on, you can send me an email and then I will have it and I can ask the question and then you can watch it later. So that's just something, a heads up for you to keep up. So I have an email that came across from Tracy, and she has a little dog named Sadie. And Sadie was diagnosed with seizures. And Sadie's now taking zonismide, which I talked to Dr. Mccarron beforehand because I didn't want to botch that name. And neither one of us know what that drug is because it's probably a new one. But her question is that she's giving 25 milligrams in the morning and 50 at night for close to a year now to help prevent seizures. She's 5 years old. She's a Maltipoo and was diagnosed last July. Her question is, I'm worried about keeping her on the medication as it's not good for her liver, and I don't want to medicate my dog. I'm hoping Dr. Mccarron would have an alternative option that could help Sadie. She says that she's happy, but last night, and this is meaning really last night, she gave the recommended dose that the vet has suggested, and she noticed that Sadie's breathing was not normal for her, and she didn't like it. So she's really concerned that she's giving too much of this and wants to know if you have any recommendations or something about seizures you would like to talk about. Help us out.
Well, I think it's obvious to you certainly that I have a different view on this. I changed my veterinary practice decades ago to more of an alternative approach, as we're talking about. Nutrition and homeopathy primarily is what I finally focused on. And and the reason I did that was just what you're saying. The first few years that I practiced, I was not impressed with using some of these drugs. I started to see side effects. I began to understand how to put it, that drug treatment is not necessarily restoring health. And so I began to look for other ways to do it. And that's what led me to find a different approach. So that's what I would speak from. What I would do now, if she were my client, I would recommend differently. So I think the first thing to understand is that the conventional veterinary method, which is using a drug like this, is basically giving something that prevents the disease from expressing itself. The condition, I don't know if I should say disease, the condition, say, from expressing itself. In other words, the dog has this disturbance in itself such that it's going to occasionally have a seizure. And giving the drug can block when that, if you can imagine, inside the dog, there is the trigger to have a seizure.
Right.
But the drug prevents the trigger from being communicated to the rest of the dog. Does that make sense?
Yeah. Yeah. I hope it does to our listeners. I know she's going to watch this on the replay. So, yeah, it makes sense.
So the drug is just simply preventing the expression, like if, say, for another
So we
example.
turn the engine off.
Yeah, or we prevent it from, we don't really correct the underlying problem. What we do is prevent the expression of the problem. So like, for example, let's say, let's go to a person, it might be more understandable. You have a young person that has a problem with anxiety and feeling, aggressive at times and so on. And so they're put on Prozac or some drug like that. They may not express that anymore, but they don't feel any better inside. You see, that's because the drugs are simply blocking the expression of the condition. And that's important to understand. I'm not saying it should never be done. Maybe it's the best that can be offered. I mean, medicine has helped in some ways, but I think there's better ways to approach it. And the better way I would use is I treat it with homeopathy. So I'll speak for a moment from that understanding, okay?
Yeah, let me tell you a little, just the little that I know about Sadie. So I know she stopped all flea and tick medication after the seizure. Like all of that had been stopped. And she has her on a diet that is called small batch. It's a lightly cooked, it's a whole fresh food diet. So she is doing that. It's not a vegetarian diet. Although I did suggest to her possibly taking away some of that meat and adding in some fresh veggies.
Okay.
But that's what I know about her for now.
Yeah. So certainly the food that's being eaten is certainly could be a factor. In my mind, there's two major factors for dogs that develop epilepsy or develop seizures.
Yeah, and everything else has been ruled out. There's no liver shunts or brain tumors.
Right.
All that has been ruled out.
I would say the most common factor is rabies vaccination. That for seizures in dogs, because what you're doing with the vaccine is you're not communicating the entire disease to the extent that it expresses rabies. Otherwise, we wouldn't use it, right?
Right.
The idea is you create immunity, but you are communicating the energy behind the disease, and it will disturb the dog. It isn't always seizures. Sometimes what happens is they become more suspicious. They start biting. They start being aggressive. That's a common one. Another common one after rabies is the undeniable desire to escape and wander.
Wow.
That's a symptom of natural rabies.
Natural rabies, yeah, we know that.
Yeah, the animals run off and run hundreds of miles. So you'll have a dog that before the vaccine, was quite normal and happy in its yard, in its house. It gets the vaccine. And after that, you can't keep it confined. It digs out under the fence. It runs whatever it can get away. And a third one that's very common is seizures. There are other possible symptoms, but those are the three patterns I've seen very often. So then the other thing we've talked about is nutrition. It might not be the vaccine. It might be what's in the food they're being eaten, because there's a lot of toxic substances in common diets that are fed.
Yeah.
And there's like mercury, and there's arsenic, and there's other substances that themselves can accumulate in the body and the brain and cause disturbance. So what I did in my practice was, as you were saying earlier, first change the diet as much as I could, get them off some of those things, because that sometimes will clear it up by itself. And then I'd also used homeopathy to treat the effect of the rabies vaccine, which works quite well.
Detoxing her from the rabies vaccine?
Well, it's not really a detox. It's more like a canceling.
Interesting.
I know it's hard without going into homeopathy, but homeopathic treatment doesn't block the expression of the disease. It doesn't act like a drug. It's not a drug. The remedies that are used to stimulate the natural rebalancing and healing of the body. And it cancels out the effect of the vaccine. So I would say to this person, I would look at both of those. I would certainly consider improving the diet, making it more healthy, and also find a veterinarian that can treat it with homeopathy is what I've been doing. There might be other one that maybe Chinese medicine can help. I don't know other things, but that's what I would do.
We're really limited here in Orange County for homeopathic veterinarian. So she's kind of going to probably struggle a little bit with that. But I'm going to tell you a little interesting thing. When you said rabies vaccine, I cringed because I know this dog. She's a client of mine. And how I found out about Sadie's seizure was that she just kind of had a seizure. She didn't even really know it was a seizure and rushed her to the vet. And the vet said, well, and I thought this was fair. It's the first one. It was small. Let's wait and see what happens kind of thing. But while you're here, she's due for her rabies vaccine. And, the owner has no idea and doesn't think anything of it because why would she? She's not trained in anything. Right. And they actually gave her the rabies vaccine that day without even knowing. It's not the owner, but I don't even blame the vet because I just think the training is lacking. We're lacking in our veterinarian schools in training to think that you have an animal in front of you that may or may not have just had a seizure because she wasn't in the seizure at the time. She was perfectly fine by the time she got her to the vet.
Yeah.
And to have given her that rabies vaccine right there.
Well, and Carrie, what's an odd thing is that if you look at the leaflets that come in these vaccine boxes, it says in there, as far as directions, only to be given to healthy animals.
Yeah.
So why do veterinarians give vaccines to animals that aren't healthy?
That's my point. Where did that come from? I don't think, because the schools aren't teaching them that a dog sitting in front of you that may or may not have just had a seizure is definitely not healthy.
It's not healthy,
Our definition of what is the definition? I'm curious, I wonder what the vet school's definition of healthy is.
Well, I can't remember that we ever discussed that in vet school.
Right. Have we ever defined what that is? Because I think an ear infection isn't healthy.
No.
I think any skin problems, allergies, all of these things that veterinarians kind of put aside and say, oh, well, we can still vaccinate, to me is still the body responding and saying it's not healthy.
I think in your future discussions with other veterinarians, you should ask that question. What is your definition of healthy?
Yeah.
Wouldn't that be interesting?
Yeah. Well, while I've got you, what would your definition of healthy be?
You're good, Carrie.
Well, I'm like, that's a good question. What is it? I don't even know what mine is.
I would say healthy is a state of natural balance and harmony, which is our default. Do you know what that word means, default?
No, explain. I mean, no, but.
It's kind of maybe a computer term. When you buy a device like that, it comes to you with a standard setup.
Okay.
Right? And you can customize it, you can change it, but the default is called the way it arrives in supposedly the optimal condition. Okay? So if we talk about health for you or your dog, I'm saying that the default, the way it is for them when they're born and brought into this world is a state of health. That's normal.
Okay.
And then everything is functioning normally as far as balance and harmony, no discomfort, no pain, no suffering. So what happens as we go along is something comes in to disturb that balance. That's what we're talking about, whether it's something in the food, stress, drugs, injuries, whatever it is, that's what happens to our natural state. And then we're thrown out of balance. And when we're thrown out of balance, our body begins to show abnormal, in the sense of unusual symptoms. That make sense?
Yeah, it actually does, because it's very simple, which is what I love about your book. It's very easy to read. But it's very simple in that if you got your dog and he didn't have an ear infection, now he has an ear. You got him as a puppy, he didn't have an ear infection. Now he's got an ear infection. He's not healthy.
No.
It's pretty simple and basic when you think about it that way.
And you could say there's different degrees or levels, but still the fact is they fit into the category of not healthy.
Sure. Yeah, it's really, really unfortunate how much, even bacterial infections. you go in and your dog has this really bad bacterial infection, and they'll give you all their medicated baths for the bacterial infections. So you gave me a medicated bath. That should be a trigger, I would think, for a vet to go, oh, I have to give medication for this skin, although we could go off on that tangent. And then they'll also give you a rabies vaccine at the same time.
Oh.
It's so bizarre and strange to me.
It is. It isn't good immunology.
No. Oh, that's exactly. It's not good immunology. And
no, it's not.
So have you,
I'll give you a quick analogy. Okay. The immune system the immune system is very elegant, and it's evolved or developed over millions of years. And when you study it, it's really incredible what it does and how well it works. However, the natural way in which it's brought into action in nature usually is one thing at a time. It's very unusual to have two diseases at once.
Really?
It's usually one thing at a time, and that's what the immune system is really good at dealing with. In other words, the way to put it in words is it really is good at focusing. Okay, does that make sense so far?
Yeah.
Okay, so then, let's say then, as an analogy, you're the immune system, but you're a person sitting in your house, and somebody is breaking in through your window. And so you're reacting to it, maybe grabbing your phone to call the police and maybe taking a picture. But then in the middle of all this, a different person started breaking in the front door. Well, now you're really confused. What's going on? See, which one do I look at? Which one should I focus on?
That is a really good, because those are symptoms, basically, you're talking about.
Yeah. But so when you give two diseases, like the animal comes in with a health problem, and it's being treated, and the immune system is reacting and responding to it. And now you give a vaccine, you're giving a second disease. The immune system goes bonkers. It's like, what do I do? What do I do?
Wow. Yeah, we're not treating animals correctly.
No,
for sure.
That's not the way. That from our understanding of immunology is not the thing to do.
Yeah.
No.
Have you, going back to seizures, have you had great success with homeopathy?
Yes. I was very encouraged by it. I would say most of the time seizures would be eliminated.
Yeah. I had a dog come to me. It was a woman I saw on Facebook, and that gets me in more trouble with these dogs because I want to save them all. So I see this post on Facebook about a dog that a woman pretty much needs to either find a home for or have him put to sleep because she just can't afford the seizure medication.
Oh, yeah.
And she's a single mom, and she's spending all this money on seizure medications. And so, of course, don't put him down. I'll take him. So I took him. His name was Bo, and he was on phenobarbital, flea and tick medication, really poor diet, all these things. So I took him, and we weaned him off the phenobarb, started him on CBD, changed his diet, and then eventually he had no more CBD, and he just was fine. And he still, to this day, he now lives with a girl that works for me because she took him home. It's been 4 years, I think. He is completely seizure free, no medication.
Wow. Oh, good work.
No medications at all. So I didn't have anything to lose. He was about to get put to sleep, and give him to me and let me see what we can do. But I know people get really nervous and about mixing things. Is something like homeopathy, if someone wanted to try homeopathy and their vet was saying, well, you have to wean them off. We always hear you have to wean your dog off of these medications, and some you do. I know some, if you go cold turkey, you could make an animal sick. But would homeopathy be something like I did that with the CBD? We slowly weaned off phenobarbital and then mixed, and then we were doing like half phenobarb part. Can you do that with homeopathy, or would that completely
well,
homeopathy?
Excuse me. I guess I got excited. Yeah, I guess we could say yes, but it's very difficult.
Yeah.
The problem is, sorry, I got a cough again.
Yeah.
Swallowed something.
You want to get some water?
No, I got some here.
Okay.
Going back to what I said about how homeopathy stimulates the body rebalancing. As it goes through that process of rebalancing, it begins to use, let me see, how can I put it? The healing response to homeopathic treatment involves realignment and reuse of the mechanisms of keeping health, such as the immune system and digestion and all the other parts that we see of functions of the body. Okay, does that make sense?
Yeah, yeah.
So it utilizes that like it would utilize a tool. You know what I mean? It's like the homeopathic remedy stimulates then the healing mechanisms of the body to bring back a balance. The problem is when as I said earlier, how the drug prevents the expression of the natural mechanisms of the body, which are out of balance. And if the drug is continued, it also prevents the homeopathic healing. You see?
I figured that's what you were going to say, because it's similar to trying to heal somebody who has cancer, and you use 2 trains of thought, right? Chemotherapy, which is killing all of the cells, and over here you're trying to build the cells. So that's
right.
kind of what you're saying.
They work against each other. That's the problem.
Yeah, so they're going to fight against each other. Mm-hmm. So I know when we talked about homeopathy in the past, you said one of the greatest things about homeopathy is it's not a continued thing that you do once you've balanced the body. So if someone were to use homeopathy for seizures and they had the right veterinarian that could help them come up with the right combination and everything that they need to do, all the stuff I learned from you, how long does it usually take to balance a dog so they wouldn't have to be on homeopathy anymore?
Yeah, it depends on the situation. Let's say, go back to the dog we were talking about earlier that just had the first seizure and went into the veterinarian. At that point, it would be very easy to treat it, and it'd be normal in days or a week,
Yeah.
But let's say the dog, instead of that, it's brought to you after it's been having seizures for 6 years.
Yeah.
And it's been on several medicines.
Oh, it's gonna take
well, by then, it doesn't. The use of drugs to inhibit the expression of the disturbance, gradually over time weakens the body, because you're inhibiting or preventing the full functioning of it. You see, like let's go to inflammation. A lot of people think that inflammation is something that should be controlled, and they'll use steroids or drugs or something like, say, for example, if you get an injury. If you were to get bitten by your dog or you cut yourself in your arm or something, okay?
Right.
And then it becomes inflamed. And what I mean by that is it becomes enlarged, swollen, and red, and some pain and so on, maybe some discharge. Well, what's happening there is that the body is going through a healing process. The injury area triggers the whole body to respond, sends in special cells through the blood system, and to repair to kill bacteria and repair the tissue. And sending the special cells in, it causes the blood vessels to dilate, and then fluid to ooze from the blood vessels into that tissue that's injured on purpose, because then the fluid that's there allows the cells to come in and move around and clean up the mess.
To heal. Wow. See? Yeah. So inflammation is not always bad.
That's the only way the body heals.
Yeah.
Okay. Now, before we move on, what's one of the most common things people do if they have an injury like that and there's some swelling and pain?
An injury like a seizure? Oh, no, like a dog bite.
Or a cut or something.
A cut or something. We clean it out.
Yeah.
Put ice on it.
Ice? Why do we put ice on?
I don't want to say it. To reduce the inflammation.
Yes, and what does it do?
It's blocking the healing process.
It causes the blood vessels to contract.
Yes.
So we're just stopping the inflammatory response. So that's a natural mechanism for the body to heal. We block it, and so the body doesn't completely heal, and there might be an area of weakness thereafter.
I had never thought about that. It hurts. So we want to make the pain go away. So we're like, here, put some ice on it, make the inflammation. I
Right.
never, ever considered that.
So the thing is that the usual method of treatment is using something to stop the expression of the natural healing response because they don't have any other way of dealing with it.
Right.
So over time, the dog that's had seizures for years, because of that treatment, gradually loses the ability to rebalance. Now, it's not impossible. I have had cases where they brought to me after a long time. If they're patient, and we can gradually taper off the drug, and I prescribe from some experience, they can still recover. But it's going to take a lot. It's going to take months, a year, maybe.
Yeah,
it's not going to be fast.
She hasn't been on. It hasn't been too long, so I think there's hope for her. And her mom's dedicated. Her mom's dedicated to this. So I think
you got to find somebody though that's skillful that can help you with it.
Yeah, I'm gonna try to find a local person that can help her maybe with some homeopathy and get her. I'll have her listen to the podcast we did originally, so she can learn a little bit about what it is. So she can have, because people are really afraid of it. Homeopathy. I told you when I first heard about homeopathy, I thought it was some kind of algebra thing, and I freaked out because I was like, 2 times X. Oh no, I'm out. Like, I can't. Algebra was never my friend.
Yeah.
For those of you who are listening and don't know about homeopathy, it has nothing to do with algebra. Turns out.
No.
So
we also have on my website. I have a referral listing, and you can go in there, and go down to referrals on the menu.
Okay.
And there's a listing of states, and you can go into California and see who's in your area.
Okay.
It's not a real extensive listing. We've had over 500 vets go through the training program, and not all of them want to have referrals. They're busy. Yeah. But you will find there maybe somebody that's accessible to you.
For her. Yeah. I'll find someone. I had a veterinarian out here in right here in Orange County. Can't say her name. She works at a veterinarian clinic, but she is from another country, and so she doesn't have her license here in the U.S. yet. So she's working in a vet hospital that is absolutely against homeopathy and holistic stuff. I don't know how she's doing it. She's keeping her mouth shut till she gets her license out here. And I told her to contact me when she's ready. So I'll
right. It's funny, isn't it?
It's got to be so hard. I mean, I don't know how she told me it is so difficult, but she's got to do this, and she's doing it for the animals, because then she can get her license here, and then she can do what she needs to do. But she has to work here. I think she said she has to work for 2 or 3 years here before she can apply for. I can't remember all the legal stuff, but
you have to have two. You have to have 2 hats, a black one and a white one.
I
change them.
People have asked me, why don't you go work with a vet? You would be so good. I said, you find me a vet here in Orange County. I could not walk into a vet clinic now and give a rabies vaccine to a dog who just had seizures. Like, I would go running out the backyard crying. So I couldn't. I'm happy where I am anyway. I think you guys are helping me.
You're right next to Disneyland, aren't you?
Yeah. Yeah, I don't know that it's the happiest place on earth, though. When I go there, I want to put earplugs in and run. Kennedy has a question for us. This is a great question, Kennedy. And we talked earlier about epidemics and things that we see a lot. I can't tell you how often we see hot spots. So Kennedy says she's currently struggling with hot spots on her 8-year-old Labrador Retriever. Thoughts on how to go about treating hot spots? Any diet related can you include or should stay away from?
Yeah, I would say the first thing I would do that I would recommend to a client with that situation is to change the diet and get to the recipes in our book, which is what we call vegetarian, right? Because very often they're reacting to what's in the meat. Yeah. So that's the first. Now, that may not work, but it very often does. It's surprising how often it does.
Yeah. I've changed dogs' diets. In fact, hot spots, I would say, was the first thing that I noticed going back to your first book, which actually wasn't a vegetarian diet, but back when I was working for the vets, I had a golden retriever who had chronic hot spots all the time.
Right.
And I read your book and I said, this is it. I'm going to change the diet. And I had just changed off of a kibble onto a whole fresh food diet, and the hot spots went away. So, but there's so much that can go on there. Sometimes I could tell you, and probably Dr. Mccarron can say this, he's seen this too. I had a dog have a hot spot the other day right around his rectum area, but it turned out he caused the hot spot because he was chewing because the anal glands were impacted.
Oh,
So
sure.
he just chewed and chewed and chewed in a spot where he created his own
Right,
hot spot.
right,
But
right.
his anal glands, I'm sure, were caused by poor diet.
Yeah, well, it certainly is a factor. It's not the
Yeah.
only factor. I don't want to make people think that's all it is.
Yeah.
There can be other things,
Yeah.
but very often that, especially things like what we call hotspots, the reason that they're going after it is because it is burning or itching or something like that. Just like you and I would do it if we had an itch, we keep scratching it. So it's usually some kind of sometimes it's diagnosed as allergy, but what it is some kind of a sensation in the skin that causes an irritation. And that's what has to be corrected. Now you can block it by using a drug that stops the skin from reacting to whatever's wrong. Let's say there's a chemical. Let's say that's a chemical problem. Let's assume there's something that's built up in the body that causes the skin to be irritated from the food. But then you can use a drug so that the skin doesn't feel it anymore. But they still have the problem, you see.
Yeah.
So that's important to understand because over time, animals don't get more healthy. That's the problem. And then you end up, unfortunately, having to put them down because they're suffering too much.
Yeah.
Yeah.
And hot spots, then they give you, I just co-wrote an article on medicated shampoos because that's what happens is you get these hot spots and the vet gives you these chlorhexidine and then you end up in like I don't know, Kennedy, if you're in this, where you just keep bathing the dog and bathing the dog and bathing the dog in chlorhexidines and all these medicated shampoos, but then you leave the skin vulnerable because you've killed off all the good bacteria that are supposed to be there as well. So now the skin's more vulnerable to hot spots. So you just end up in this hamster wheel, horrible situation. Is there any topical homeopathy type stuff that you can give an animal for hot spots?
Yeah, there are things you can use, but that's not the way it's recommended in homeopathy.
It's not.
No, because the way that health, there's more than one, three possible outcomes of treatment in homeopathy. It's the same for conventional or other forms of medicine as well. The one that we would like to have happen is what we call cure or return of health. That isn't always possible with every system of treatment as we're talking about. But in homeopathy, that's our goal, our purpose.
Return of health. I love that.
Yeah. So the basic book that was written by the doctor that developed the homeopathic method, discovered it and developed it 200 years ago, Dr. Hahnemann. If you open his standard text, he went through 6 editions.
Wow.
50 years of clinical experience, and he wrote this book that guides you in how to treat. The very first paragraph in the book says, the only purpose of a doctor's work is to cure. So that's one outcome that we want to have. The other possible outcome is what we call palliation. Palliation means the medicine is given, it has some improvement in the condition, but it doesn't restore health. So that's like using a drug for seizures, or like using a drug for hot spots to stop at the itching. Okay, but with palliation, you have to keep using it. If you stop using it, the condition comes back.
Oh my God, that's the shampoo. You just have to keep using it.
The third possibility is what's called suppression. And suppression is where you use some kind of treatment, whether it's a drug treatment for a while or surgery or something, and the symptoms permanently go away. But again, health is not restored. Let's say go back to your anal gland problem. You could remove surgically the anal gland.
People do.
Now he's not going to have anal gland problems anymore because he doesn't have an anal gland to have a problem with.
Right.
So that's called suppression. He's not necessarily healthy.
Right.
But he doesn't have anal glands anymore.
Yeah.
So those are the 3 possible outcomes. Now, going back to what you asked about putting it on the skin, that oftentimes is palliation. because you lose it as an ointment. It reduces the itching, but then the itching comes back and you have to use it again and it comes back. And yes, you can do that. There are ointments for itching that are sold over the counter, homeopathic ointments, but that's not really the best work. What you should do is, if at all possible, work with a veterinarian that can actually give the appropriate remedy that restores the health permanently. Now, if they can't find a veterinarian in their area, like I said, there's a referral list on my site. There are some, in that listing I have on my website, there are some called health consultants. There's a few, and they will work with you sometimes from a distance. So you could call somebody and talk to them. And, you know, I know it's limited. I'm sorry. I wish there were more veterinarians that did homeopathy, but it's just the way it is, you know. There's only so many that'll do it. And a lot of them that are trained with us don't carry it on because, again, what we were talking about in the beginning, it conflicts with their beliefs.
Yeah.
So they just can't do both. They try to do both. They try to do the conventional and they try to do homeopathy and they counteract each other, and then there's no particularly good outcome. So they end up not continuing it. So unfortunately, we don't have a large number of veterinarians that know how to do this work.
Yeah.
But again, I will say, you know, some other system may do it that I don't necessarily have experience with, like Chinese medicine maybe, or some other approach may also be very good.
Yeah.
I'm just encouraging people to open their mind to try something other than just drug therapy.
I'm with you on that. It's hard because we see these hot spots constantly. I don't think a day goes by that a dog doesn't come into me that has hot spots all over him.
Yeah.
I could give you a suggestion, Kennedy, but I think that going back to what Dr. Mccarron is saying is that you have to really look deep into figure out what the cause is, whether that is diet or something that's causing that. You got to look deeper. But if you can find a groomer in your area that does ozone, I get really good results from ozone baths with hot spots. There's not very many groomers that are doing ozone, just like there aren't very many veterinarians doing homeopathy. But ozone baths, I've had really good results from. And there's also a shampoo called Nui Gear shampoo. Lori can put it up for you guys. It is it's not really a shampoo. It's really just a lot of good bacterias. And I've got really good results from that. It doesn't kill anything. It's good bacteria that you're actually putting back on the body. I don't know if you've ever heard of that shampoo, but it is fabulous.
No, I haven't.
It's pretty new on the market. And it doesn't clean real well. Like when you do your dog with it, they don't walk away smelling all perfumey and happy and, you know, but that's actually why it's good. It's not putting all these chemicals and stuff on your dog.
Right.
But I've had really good results from that, Kennedy, if you want to look into doing something like that.
Yeah, and I would emphasize also to Kennedy, we can't absolutely guarantee it, but I think I'd certainly give a try of changing the diet. Work with Carrie or try recipes from our book.
Yeah.
And I think we have some in there for allergies that you could look at. So, because I just, you know, I'm not trying to sell the book. I'm just saying I really actually saw so many animal cases get better just changing the diet. It was really, that's why I persisted with nutrition.
Yeah.
If I hadn't seen any results, I wouldn't have stayed with it. But I was surprised. It was kind of a backwards thing for me in the sense that it wasn't like, oh, I'm learning new things about nutrition and I'm going to apply it now. And now new things and apply it now. It was like I would try something and I'd see great results. And then it would make me go, oh, well, I guess I didn't realize. And so that was kind of, you know, stimulate me to go forward again.
It does, you know, that's such a good example because like if I go all the way back to the vet world and we were feeding kibble that was really bad kibble. I mean, if there's a scale, these were really bad. And so when I learned that there was better kibble, and there really is, even though I don't believe that so much now, but there is. I mean, if one kibble is using, you know, a lot of preservatives and you can find one that has less preservatives, all that stuff. Just that is what got me when I kept going. Cause I was like, oh, I saw a difference between the dog that went off of that super ultra processed kibble onto this not so processed kibble. They're all processed, but
right,
and then you start going, well, if that can do this, let's see what this can do and this can do. And you just keep going and going until you're just like, your mind is
right.
blown by what nutrition can do. It's just,
Yes.
which is why when I brought you on the show to talk about, what you're learning about giving vegetarian diets, I didn't want people to be closed-minded to it, because, you have to want to learn. If you're ever going to evolve, you have to learn. And that doesn't mean you have to agree with everybody, but you certainly should be open-minded enough. And every dog is different. And that's one thing I say to people all the time. What's good for your dog may not be good for this dog, may not be good for that dog, but don't just close it down.
Right.
Just because you haven't tried it. And, like you said, some people, my father-in-law, thank God, won't be listening to this, but he has for months been telling my husband and I that his cat is healthy and she eats kibble. And so he's like, oh no, she's healthy. She's healthy. She's healthy. Well, I went over there today and she's got 2 ear infections.
Ooh.
Yeah. I'm like, no, she's not healthy, but his definition of healthy is she's running around and she's happy. So,
I see. Okay.
Yeah, he's old school. So, but I am going to encourage you guys to get Dr. Piquet. He doesn't want to sell his book, but I am going to sell it for him.
I'll sell it. That's okay.
You should get it. A lot of effort. His wife, Susan Mccarron, who we had on the show before, she put a lot of effort into it. You may not use everything in that book, but you'll get something out of it. I promise you will get something out of it. And then you'll be able to share it to your friends and your family. Mm-hmm. So I do encourage you to get it. Lori put it up here for you guys. I think you can get it on Amazon too, right?
Right.
Is that
and also, I don't know. I think it's sold through bookstores like Barnes & Noble and other places.
Yeah.
I was going to say also in the book is a homeopathic treatment recommendations. Now, it can't be it's simplified. It can't be complete because, it takes some study to be a practitioner. But, you look at our book, there might be something for skin conditions. Yeah. Try this remedy, try that remedy. So we try to give the best likely suggestion we can to at least get people started and interested in it.
Yeah. No, that's good, because homeopathy is, it's scary. I have a whole bunch of books now on homeopathy after I did this with you, because I do think I'm very intuitive with animals. Like sometimes they just come to me and I could sense something's off with the energy, and that may be weird to people. But so I thought, I can't, because I'm not a veterinarian, so I can't do homeopathy for my clients or other pets because I'm legally not allowed to. But I wanted to be versed in it. It's hard. It's really, it really takes an understanding, right? Because not every dog that has pancreatitis won't have the same homeopathy treatment, right?
Right. So interestingly, the way to understand this, Carrie, is that, if we look at it historically in medicine, not just homeopathy, but before homeopathy, going back to the time of the Greeks, when there's earlier records of the attitude and views of medicine. Right. There were two prominent, there are on many views, as you can imagine, but there were two prominent perspectives. One perspective was that when an individual develops some kind of health condition, that in a sense, what they're experiencing is unique to them. It's their individual experience. They may be somewhat similar to what somebody else is having, but what they're having is their own individual experience. And to understand how to treat it, you have to look at that individual very carefully, find out everything you can about them to see what they need. I'm not just talking homeopathy. I'm talking about, this is a view of medicine back in the time of the Greeks. Okay? Right. The other view was, basically, put it in my own words, that's too complicated. It's easier just to put everybody with a particular type of symptom together in one category and call it diagnosis. And everybody that has a diagnosis gets the same treatment. Those are the two views, and they have continued since that time into our present day. The first view is the view of homeopathy, probably the view of Chinese medicine, chiropractic. I don't really know enough to say, but that's where you look at the individual rather than look at diagnosis. the other view of saying grouping the animals or the people together under one category is the conventional system that we call allopathic. That's why they put so much emphasis on diagnosis, because then once you've made the diagnosis, there's only one treatment.
Yeah, we see that all the time. A
Yeah,
equals B.
yeah. So that's a simpler way. You can see why it's appealing,
Yeah.
because then you know what to do. You don't have to figure it out. Whereas the first one, like with homeopathy or a similar method, you really have to spend time looking at the individual. Well, if it's a person, what exactly you're feeling and where and when and what brings it on and all that stuff. Or if it's an animal, observing them, what exactly do they do? What part of the body? What makes it worse? That's what we ask.
Yeah.
And then once we know that, we can match the remedy to it for that individual. So you could have, say, you could have 5 dogs come in with hot spots. And it's very possible with homeopathy that each one gets a different remedy.
Yeah. That's why it's so important to work with the homeopathic veterinarian, because they'll know what questions to ask.
Yes.
If you're starting off wanting to learn homeopathy for your pet, you first need to start learning what questions to ask. And that's hard.
Yeah.
That's probably the hardest part, right? It's figuring out why you're asking those questions and what questions to ask so that you can come up with the right remedies. So,
right.
But I love it. And Janelle has one more question. She wants to know if in the book, I know you said that the recipes were complete and balanced, that Susan worked on a lot, right?
Well, whatever, I don't know. In the earlier editions, we had a supplement, healthy powder, we called it, that you added to the food. I can't remember, honestly, in the last edition. I think we did have something still to add in, but we tried to emphasize as much as possible that each recipe was balanced.
Yeah.
I'm sorry I don't remember.
That's okay.
I should know since it's our book, but it came out in 2017, and I haven't read it much since then.
Yeah. I know Susan spent a lot of time. She was on the show when we were talking before when we did the podcast, and I know she had spent a lot of time doing some research on balancing. So I would imagine that it's complete and balanced.
She's very good.
She's going to let you know in the book that you need to add.
She is very good. She's very sharp, and she really put a lot of time into it.
Yeah, she's very passionate about it. If you haven't watched the podcast we did, go back and watch it, because she's my people.
I never could have done the book if it wasn't for her.
How long have you guys been married?
About 45 years.
Better get that question right. All right, we've kept you. We're coming up on that hour, Dr. Mccarron.
Okay.
You just make me smile. I will listen to you forever, even if you do come up with some crazy ideas later on. I'll still listen to you. So I just think you're so brilliant. Brilliant in the fact that you keep evolving and learning and changing, and you're so willing to bring that information to us, and your knowledge and your experience and all the veterinarians that you've taught over the years. Do you even know how many?
Well, the course that we have a year-long course of training in homeopathy. And unfortunately, that course didn't happen last year because of the virus, but we hope to have it going again. Anyway, in that course that started in 92, we've trained over 500.
That's amazing.
Now, I've had other vets that haven't gone through the course that have come to meetings or in person more recently, last decade or so, more online.
Yeah.
But yes, so I don't know, in the hundreds.
Yeah. That's amazing.
But of course, there's a lot more than hundreds of veterinarians in the country.
I told you a long time ago, I called and wanted to take that class, but I couldn't because I'm not a veterinarian. And you explained it so well to me that it is a legal way to practice veterinary medicine. So it would be very similar to me going, can I come to vet school and then go treat? So I couldn't.
Well,
but maybe one day you'll let me come out there as media and I can come out.
Yeah, I would love to be able to have you take it. The problem is, it's not that we don't want you to take it. I think I would personally think it wonderful if we could include anybody in the class. Yeah. The problem is, I think people will appreciate this. They'll understand, especially with what's happening recent times with this virus epidemic, that when doctors speak out with any kind of alternative view, they're often severely criticized or they lose their jobs. That has been the situation with homeopathy, with alternatives. What I mean is that homeopathy is considered part of veterinary medicine, a small part, by the state boards. Okay, they don't say that you can't practice it. It's never been illegal.
Right.
They include it as part of practice. They're not pushing it. They don't particularly necessarily like it, but they include it as part of veterinary practice. Now, if we bring in our training program non-vets and train them, we're going to lose that status. They're going to completely reject us because they don't like the fact that we're training non-vets that will go into practice in competition. So it's a political issue.
Yeah.
In our training program, to get their approval, we have to comply, and that's the issue.
Understood.
Now we've let some people in the class, like that are vet techs.
Yeah.
That's promise us they're only going to work with a veterinarian.
Yeah.
Or we sometimes have let somebody in that isn't going to practice. They tell us, like one that is very active now is a woman that runs a rescue farm. So there are exceptions, but as you say, we can't really teach you to use it and go into practice. Then we're in duty.
Yeah, I wouldn't want to do anything. If anything, one day I hope I'm still on this planet when it becomes more mainstream.
Yeah.
Because what we're doing right now is not. I'm here to tell you guys, it's not working. Our animals are getting sicker. It is
right.
It is not working. So all that fear of something that's different. I have people say, well, this is the only thing that works. And then I look at the dog and I'm like, it's not working.
Right.
It's not working.
Yeah.
But they just get it in their head that it is working. And so traditional veterinary care is not working. And
I wouldn't even use the word traditional, because tradition means you're carrying on something that's been going on for a very, very long time.
Right.
Allopathic medicine, I call it conventional, because I read a study once that was done, and it said that in the medicine we're talking about, the conventional system of medicine, like the doctors use for people or veterinarians use for animals, that the knowledge or information contained within that system, 50% of it is changed in 5 years. Now, if you have something changing that much because they haven't come to any real certainty about the best way to go, that can't be a tradition.
Well, that's a good point, because look at the changes. Like if you just right now look at allergies, Apoquel, then, well, first they would do prednisone, right? That's back in my day. It was prednisone for every dog that walked in the door. And then they started coming out with these other things. And then it was Apoquel. Apoquel is now causing cancer according to their own. I'm not saying that, it's actually on their insert now, and now we're on to Cytopoint. So you're right. I mean, you're right. It's not traditional. It just keeps changing because it's not working.
It's really, I think conventional is the best term to use, or allopathic.
Yeah, I got to change my language. Because,
it's all right. I just thought I'd mention that.
Yeah, no, that's good. You're right. Because if anything's traditional, it's homeopathy.
Well, it's for 200 years, yes. It's tradition.
That's a pretty long tradition, and it hasn't changed really, right? Like, doesn't.
Well, it has. It's just like anything, Carrie. It has its challenges. One of the big challenges in homeopathy is the constant. I don't know what word to use. Influence coming from outside homeopathy to consider using it a different way. So to combine it with allopathic treatment, for example, or to use it in different forms.
Yeah.
So there are different schools of homeopathy that have developed. And so that's an issue within homeopathy itself, that now there's different branches. But I'm talking about the homeopathy that was originally developed, is still continuing. That's the one I found worked the best for me.
Well, hopefully, when is the next class start out there? Is it like?
Well, we don't know. We don't have a date yet. I hope we're going to get one started next spring. But again, we haven't scheduled it yet.
Well, we'll have to
It's
talk when you come up with a date if you want some media coverage. Not that I'm a
okay,
big media person, but I would love to come out and at least do a little talk about it and try to get more veterinarians involved in doing it, because we
right,
need you guys. We need
yeah,
this. And if I could do anything to encourage a veterinarian to take your class, I would absolutely. I have a girl working for me right now that wants to go to vet school. I'm super excited because I'm like, oh, I'm going to get her before she, I'm going
that's
to get her
good.
before.
Yeah.
Yeah. So, all right. Well, I'm going to let you go. We're going to talk soon. Keep me updated. Send me an email or something about the dates on that.
Okay.
Any
When we have
last
'em.
words that you have?
I appreciate what you're doing. As you said a moment ago, we really, I know if I say that we have to make a change and have a new system of medicine, it sounds like I'm coming from my little tiny spot here. But I really think, after my experience of, over 50 years of being in veterinary medicine, I'm speaking very honestly from my heart. We really have to open our minds and embrace alternative systems. A lot of people don't realize that, at least in the U.S., that what we're operating with is what's called a monopoly. A monopoly where there's only one thing available. Now, yes, you can get chiropractic. Yes, you can get homeopathy and whatever, but you can't get insurance coverage for it usually. And it's not encouraged. It's put down. And so we have a system that's really in charge, and that's a monopoly. There are other countries you go to where you actually have choices.
Yeah.
So I'm really encourage people to you don't necessarily have to shut down another system. But I think we should have choices about what we
Yeah.
use. We have to open our minds to consider the very first thing is that we really truly don't understand a lot about our bodies.
Yeah.
We don't really understand a lot about health, and we shouldn't assume that we do, as often is the case in medicine. Oh, we know it. We know more than the immune system knows. I don't think so.
I don't think so. I would venture to guess that we're only in our infancy of actually
Well,
understanding it.
we
It's kind
are.
of like the universe, right? We have no
Right.
idea. We have no idea.
No,
So,
no.
all right. Well, I just want to thank you as always for just being so giving of your time and your knowledge and sharing all of this with us. You're just really, I just love talking to you.
Oh, thank
I
you.
learned
I
so
enjoy it
much
too.
from you.
I
It's awesome.
enjoy it too. Yeah.
Thank you. And then
Okay.
to all of our listeners, thank you for bringing in your questions. I know sometimes people can get a little nervous when they're typing out some questions, but as you can see, just a simple question that you think is no big deal can take someone like Dr. Mccarron down a road that will educate you so much more than you could ever imagine.
Yeah.
So thank you, thank you, thank you for writing out these questions to us. Remember, you can always email them to thespadogs@gmail.com if you can't be on Wednesday nights. And I can read them and you can watch these later. If you want to share this later, it will be available. Lori's giving you all of that. Lori is behind the scenes. So Lori, as always, thank you so much for setting this up. I am not a tech person, so if it wasn't for her, we would not be here. So I have to shout out to her. So with that, I'm going to say good night to everybody, and we'll see you next Wednesday. Bye, Dr. Mccarron.
Bye.